In LA County, coronavirus cases are on the rise while RSV cases may have already peaked. That's what we learned today at the briefing with Health Director Barbara Ferrer, who also said another indoor mask mandate could be reinstated. This while the COVID booster rate remains dismally low. To discuss all of this is Dr. Nina Shapiro, a pediatric ENT, or ear, nose, and throat doctor at Westside Head and Neck. And Dr. Shapiro joins me now live. Dr. Nina, I want to first and foremost thank you for being with me, but then get your thoughts on the potential of another mask mandate in LA County. Earlier this week, you said that we didn't necessarily need one. You'd be surprised if we had one. We heard this from Dr. Barbara Ferrer today. Do you think that a mask mandate is necessary, or is it about time that people just have to take their own health into their own hands?
So what I said was that I didn't think that she would instate one. I didn't think it wasn't necessary. That's a whole other question, and I think in answer to the second part of your question, it's time for us to take our health into our own hands. Well, we've seen what's happened with that. There are so few people wearing masks, and that's been individual decisions. It's strongly recommended, but very few people are wearing masks right now. For those of us who traveled over the Thanksgiving weekend, for those of us who flew, I would say 1% to 2% of people were wearing masks across the country, including in Los Angeles. So is it necessary to have a mask mandate? You know, it's such a tricky time right now, and people are so tired of this. But we know what we need to do to stay healthy and safe. And unfortunately, masking, or fortunately, masking is a good option that works to prevent spread of illness. It prevents the wearer, it prevents the people around them. It's not the only thing that can be done, but it does really help. It's unfortunate that we have to consider the notion of a mandate at this point, knowing how much masks help. But I'm really surprised if actually Barbara Ferrer and the LA Department of Public Health are going to institute a mask mandate. I would hope that that wouldn't have to be the case, and I think that people would want to wear masks to protect themselves, but it may come to that. I'll be surprised still if it happens.
We'll see. It could happen before the new year. And the other issue that we've talked about before is enforcement, because there isn't necessarily enforcement, and then also compliance. Will people comply? We'll wait and see on that one. Okay, so you are dealing with RSV and COVID in your office right now. Which is more of a concern for you, and why?
So I take care of little children and their families and their friends, and we are seeing a ton of RSV. I know that it hopefully has peaked in LA County, but kids are still getting RSV. And it's not the kind of illness that you just get one day and it's gone, or you get in the hospital one day and you're out of the hospital the next day. So even if it's peaked, it doesn't mean that it's over by any stretch. And hospitals are still packed with sick kids. And with that, again, they can stay 2 days in the hospital. Some of these kids are staying weeks in the hospital. And even if the new hospitalizations have peaked, the hospitals are still filled with these kids. And from an outside standpoint, if you have a child who needs, say, an elective procedure, an elective admission, or a non-emergency procedure, a lot of those are being canceled and delayed because there are no beds.
You know, and I should also make clear that today in her presentation that she showed a slide where it was boop for RSV cases went up, and now they're going down. And that she thinks may be that we have peaked in early November, and here we are in early December now. So let's hope that that's the case. What are you telling your parents who are so concerned about this?
Well, you know, I think it is at the point where kids, especially parents and families, have to live their lives. I don't think this is a time where we should say that kids should quarantine or lock down or anything like that. But I think RSV, COVID, flu, influenza, all of the other viruses that are circulating, common sense is really the best thing. If your child is sick, keep them home. It will shorten their course. It will shorten the spread of it spreading to their preschool or daycare or classmates. So if they are sick, please keep them home. Whether you know, a lot of people are wondering, should I get my child checked for RSV? A lot of pediatricians are saying it really doesn't change the course, whether they have it or not. So just treat the symptoms, keep your child well, don't get sick yourself, because adults are getting RSV too this year, and you know, you need to stay healthy if you're taking care of your children.
Okay, and then I wanted to lastly get your thoughts on this, the fact that in LA County the booster rate is 16%. 16% is dismally low. I asked this question of Barbara Ferrer today. Let's go ahead and listen.
Do you fear that you and the department have lost credibility with the public?
I'm not sure about a loss of credibility. I mean, I think lots of people still pay attention to us and listen to information. I think there's a lot of confusion about whether or not you need another booster.
Okay, what do you think it is? Why do you think, let me ask you that, why do you think that just 16% of eligible LA County residents have received this booster?
I think for a couple of reasons. I think that people have lost trust in public health, not just the LA Department of Public Health. I think the messaging has been confusing. A lot of that is because this virus has been very confusing, and the data changes as we learn more. The vaccine functions change as we learn more. The monoclonal antibodies now change. You know, there's so much evolution of this virus, but it's very confusing and very frustrating, and the messaging has been mixed. So I think that's one of the reasons. I think there's been some complacency that this virus is no longer quote unquote deadly or serious, so the bivalent booster is not necessary. So many people have had COVID infections, especially over this past summer, that they feel that they don't need a booster because they just had the infection. I will say to that vaccines work, and they do help. They keep people out of the hospital. They keep you from getting this virus. It doesn't mean you won't get it, but I really do think that the bivalent booster is something to consider. So I really do encourage people to get it. And the rate is dismal. I'm shocked that at that number, how low that is.
16%.
Yeah.
Okay, Dr. Nina Shapiro of Westside Head and Neck, thank you so much for being with us tonight.
Great to be here. Stay well.